We're approaching the 2-year mark of life with COVID next month.
It's hard to believe, isn't it? Some healthcare officials are declaring that we're entering a new phase of the pandemic, moving towards an endemic approach.
But it remains a source of major debate. UW Health's Chief Quality Officer, Dr. Jeff Pothof, is back with us for his weekly visit. Welcome back, Jeff.
Hey, good to see you guys.
So are we nearing an endemic phase of this?
You know, I think things are pointing towards that right now. I think, we can never discredit the ability of a variant to be discovered that somehow creates problems for us, but none right now on the radar. Cases are going down. It does look like, if you're a betting man, that an endemic form of this disease, COVID-19, is probably where we're headed.
Is it time to roll back some restrictions, or do you have any concern that that might still be a little premature?
I think with cases going down, the time to roll back some restrictions, whether it's masking or gatherings, things like that, it's probably fruitful territory to discuss. Whether that's today, 1st of March, second week of March, I think it's going to be hard to nail down exactly what that looks like. As far as concerns, I think in areas where there's high-risk people, particularly think around healthcare entities, we got to be careful and keep those restrictions a little bit longer to protect those people. In schools, if you have really low vaccination rates between those like 5-year-olds and 11-year-olds, which we've seen in different areas, that might cause some pause. But other than that, things are looking pretty good right now.
Well, that is good news.
It is good news.
There's stories going around the country, and I think perhaps it's happening here. The ORs at hospitals are very busy, but not with COVID patients. What's going on?
Yeah, this is a phenomenon we saw after our previous peaks, and we're seeing it now. So I think it's twofold. One, you heard us tell viewers that we had postponed a lot of different procedures, whether they were non-emergent or even tier 3 and 4 procedures, and we want to get those back on the books. So that is happening. It's keeping our OR schedules busy. I think likewise, there's a lot of people who were thinking during the Omicron surge, a hospital is the last place I want to be right now, and they weren't getting healthcare needs met. They were postponing it themselves, and now they're feeling more comfortable coming in, getting that care met. So for hospitals, who we're taking care of is changing, but the idea that we're somehow getting a reprieve or things are slow, that's just not what's going on.
Yeah, healthcare workers can't get a break, even though the pandemic is ebbing a little bit. Yeah,
I agree. I think, it's been hard for healthcare workers. We've endured a lot, but what an incredible team. They're really some special people who go into healthcare.
Yeah. Your other hat is the emergency room doctor, and it's been a busy day with this weather.
Have you seen a lot of falls and breaks? So I fell on the ice 2 years ago, and when I went to the emergency room, I broke my wrist, and they called it Christmas in March because honestly, so many people broke bones that day.
It is really common. So with ice storms, your injury is exactly what we see, and we'll probably see a dozen more people like you today, Susan, who fell on an outstretched hand and broke either the radius ulna or sometimes both of them. That's a super common injury. We've been seeing that today. People who fall and hit their heads, sometimes that's minor, sometimes that's more severe, especially if you're on an anticoagulant like warfarin or Coumadin. You want to get checked out. And then, of course, motor vehicle crashes from when those roads were a bit icier today. We see those folks in the emergency department, too, try to get them fixed up.
Yeah, any head injury, you should probably have it looked at, right?
Some head injuries, if it's just, a mild bump and you've got a headache, maybe not a big deal. Some will be more moderate, so concussion-like symptoms that you might want to call your primary care about. One thing I do worry about is folks who are on anticoagulation medicines, folks who have atrial fibrillation, or maybe they have a previous history of a blood clot. If you're on warfarin or Eliquis or some of these meds that thin your blood, and you hit your head hard after slipping on the ice, you need to be seen. There's a chance that you could have some bleeding on the brain in that situation.
All right. Well, I guess we do see finally the light near the end of the tunnel with COVID.
It's looking good.
Perhaps.
It's looking good, Mark.
Hate to jinx it.
Yes, don't jinx us.
Jeff, good to see you again. We'll see you next week.